It was almost exactly a year ago, to the day, when hospitals across the entire state were operating under crisis standards of care because of COVID-19. It was the first time Idaho faced such a situation when access to health care was being determined by your risk of imminent death. This was happening despite the coronavirus vaccine being available for 9 months prior. Photojournalist Kevin Esslinger and I were granted access to the St. Alphonsus Emergency Department, their COVID care floors, and their intensive care unit, which at the time was filled almost exclusively with COVID patients. On September 23rd, 2021, our hospitals were overwhelmed. Yes, people do die on the COVID floor without ever making it to the third floor, the ICU.
Do you want this hand scroller?
Where for the third time this morning, a code blue has been called for a COVID patient. An alarm that calls medical staff from several units across St. Al's. And for nearly half an hour, all of their attention is attuned to this one room, working and hoping to bring someone back to life. Watching you guys work, it was an emotional experience for me. How do you do this?
A couple of things. This is what I was trained to do. It's what we were all trained to do. It's not that the death doesn't affect us, right? We're not robots. We all tear up, go home and cry to our family members at various times. And then, I've said this before, you know, this is when you feel like you're doing this in the context of a team, and that idea that you're not alone doing this, that helps a little as well. Because you saw I wasn't alone in there. A bunch of people ran in to help.
They do this every time.
Oh yeah, it's daunting. And our team's struggling, right? There's this this moral distress that's happening amongst healthcare workers, amongst physicians, nurse practitioners, physician assistants, respiratory therapists, nurses, CNAs. All of us are feeling this extra weight of emotion and moral distress because so many of our patients are unvaccinated and dying because they chose not to get vaccinated.
Do you see the light at the end of the tunnel at all?
No.
You don't?
No. And that's heartbreaking for me to have to say. I did when I got my vaccine in December of 2020. That was my light at the end of the tunnel initially. But now I don't know where the end is.
Could we be there now? Well, crisis standards lasted until the end of November 2021, that is, for most of the state, with a few places returning to that standard for about a month at the beginning of this year. Remember that? It seems like so long ago. And if it feels that way to you too, well, then you're likely in agreement with President Joe Biden, who said this last night on 60 Minutes.
Is the pandemic over?
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over. If you notice, no one's wearing masks. Everybody seems to be in pretty good shape. And so I think it's changing, and I think this is a perfect example of it.
They were walking around the Detroit car show, the auto show, for the first time in 3 years, which is open to the public. So another example of it could be over. Well, we haven't done a COVID story on the 208 in months. I think it was June was the last one. Our statewide COVID numbers, which we used to wait with bated breath every day at 5 p.m. to see a tally of new cases, new hospitalizations, and new deaths, well, now we're only updated maybe 3 days a week, with some health districts not even reporting that consistently. The state COVID website, which hasn't been updated since September 7th, it says, due to severe technical difficulties. Not quite sure what that means, but there are some numbers there. But is the pandemic over? That's a question that we asked Andrew Bartline to try to, well, answer today. Andrew?
Well, you're not going to like the answer, Brian,
okay,
because it's kind of boring and it's hard to say because there's not really consensus on this. This is debatable. There isn't a firm, clean-cut definition for when the pandemic or any pandemic ends. It's sort of a series of signs. We talked with Dr. David Pate on Governor Brad Little's coronavirus work group, and he saw Biden's interview on 60 Minutes last night. He says he disagrees with the president. Pate even says his language can hurt our country's ability to respond to potential new variants.
I cringed. I can't say I'm shocked. He's a politician. We've got elections coming up. So I can understand why politicians would want to say it's over. It's not over.
Why would you say it's not over? You look around and this is what the president said. We're at this car show. Nobody's wearing masks. It feels very normal. Why is it not over?
I don't think we can judge whether a pandemic is over or not by what the human reaction is. The pandemic is more guided by what the virus is doing. And of course, human behavior allows the virus to do its thing. What I'm worried about is what's the real implications of the President of the United States saying the pandemic is over. If the President says the pandemic is over, then rightly the next question from other politicians should be, well, then revoke our public health emergency status. Because if you don't have a pandemic, why do you have that public health emergency? That's where the devastating harm will come. Everything that we're using, which is most, that is currently under an emergency use authorization, that goes away if the public health emergency is revoked. That is antivirals, that is monoclonal antibodies, that is vaccines, and it's even a fair amount of our testing. So that could be really bad.
So what are you seeing in the virus that would lead you to believe it's not over? And what do you have to see until you're going to be comfortable saying, we can pull off the gas pedal here, we're going to be all right?
Look at what's happening with the cases. Now, realize, as we've talked about many times, cases are underreported. But you can look at the cyclical spikes that we see in the United States and in many countries. Those are because of new infections. And you can look at those new cases, you can look at hospitalizations, you can look at deaths, you can look at a lot of things. But when we keep having those spikes, that is not something that has become endemic, it's epidemic at that point.
Dr. Pate did concede that we're in a much better position as a nation than we were a year ago. He attributes a lot of that success to vaccines and vaccines being made available, people getting those vaccines, where many people are comfortable now going out, living normal lives. That's a good sign, according to Idaho State epidemiologist Dr. Christine Hahn, who she also agrees with Pate, but she does say there are some positive signs too. The biggest question that she still wants answered, what's next? Dr. Hahn says she can't know for sure.
This virus, we don't know what's going to happen this fall. We worry that we're going to see a big surge, but maybe we won't. Maybe we'll see a new variant come along. Maybe we won't. So in my book, I think we're not quite there yet. I think COVID is still a problem. It's something we still don't fully understand. We're hopeful that if enough Idahoans get vaccinated, we won't see a lot of sickness. We won't see a lot of people in the hospitals, but we just don't know yet.
So, Brian, everybody likes to compare COVID to the flu per se. Now, the biggest difference right now, they know what flu season's going to look like going into it, our health experts. But there's not a consensus on what's going to happen with COVID in the fall. There are people that advise President Biden at the White House that Pate referred me to some of their predictions. They think there's going to be a really bad spike. There's some other people that think it's not going to be bad at all. So there's not really consensus. They don't know what to expect. And if you can't expect it, they say the pandemic's not over.
Well, that is going with what Dr. Hahn said. It is cyclical. We could see that spike in the fall, but what we're not seeing with the vaccine are the hospitalizations and the death rates that we did see a year ago today.
Yeah, numbers have gone down, and that's encouraging. Pate and her both said that.
All right. Thank you very much, Andrew.